adults know when something is wrong with their vision, but children's eye conditions can be more subtle, and parents may not even know their child has a problem until it's too late. Here with the best ways to detect and treat your child's vision problems is the chairman of the Department of Ophthalmology at Beth Israel Medical Center, Dr. Jay Wisnicki. Dr. Wisnicki, thank you for being here.
Thank you.
I guess the first question that a lot of parents have and people have in general is, are children born with good vision, with perfect vision?
They are not. Most children are farsighted at birth. They also have incomplete development of the retina and other parts of their eye. They only see shadows. They can't even see their mother's face during the first week of life. And over the first few months, that vision develops. They develop color vision and more precise vision to the age of 3 to 6 months, where their vision should be quite good.
And at what point, if there are going to be any problems with vision for a child or a baby, at what point does that begin to surface?
Well, sometimes it's right at birth, and the pediatrician in the nursery during his evaluation of the child may pick up congenital conditions. But more typically, those problems should be looked for by the age of 3 to 4 months.
And what are some signs of, I think one of the reasons we wanted to do this segment today was, I think it is one of the more difficult things for parents to do, is to figure out whether or not their child has an eye problem. Sometimes that gets picked up right away, in a vision problem, I should say, right away when they get to school, but until they get to school, the child may still have the problem and the parent doesn't know it.
Indeed, that's true. Many children who have poor vision in one eye from amblyopia or a lazy eye, it goes undetected because there is good vision in their other eye. There are certain warning signs that parents can look for in trying to figure out if a child has eye problems. Those include rubbing an eye, squinting, closing an eye in bright light. A child may have difficulty with double vision or blurred vision and complain about this. There are some more obvious signs like red eyes or watering eyes. But indeed, this is why children should have their vision screened.
But when a child is not reading yet, and all of the things that begin to bring testing into play, for example, the double vision, what would a child typically, at 2.5 years old, what does a child say to a parent that...
You're right, this is very age dependent. At the age of 2.5, a child wouldn't notice double vision and wouldn't say something like that to a parent.
But yet they could have that early, is that correct?
Yes, and often patients of mine will say, you know, my child's vision seems better than mine. You can easily evaluate a child's vision even at the age of 12 months. You can actually have them pick up small objects. It's important for a parent just to play a game with their child and see if the child sees. When doing that, however, it's important to cover one eye to make sure that each eye itself can see well.
So that's one of the earlier tests that a parent can do with a baby?
Yes, and they can do that.
Picking up objects off a table and covering one eye.
And very small objects like sprinkles or things like that, because the child often will be putting things in their mouth at that age.
And do you recommend that parents do that at that age?
Absolutely.
Okay, when does a parent begin to start? Are eye tests a normal procedure when you bring your baby in to see the pediatrician over the first couple of years, 3 years of life?
They are. Typically, the ages at which vision testing and eye exams are done by family practitioners or pediatricians are right at birth, again at the age of 6 months, at the age of 3.5, and at the age of 5. Obviously, these tests are a little bit different because at the age of 5, a child can read the vision chart. After the age of 5, these exams are done annually, and they're often screened in school as well. Okay.
We're going to come back and talk more about detecting these problems with the young baby that you have at home. If you have any questions, please give us a call now, toll free, at 1-888-TEL-FOX. We'll be right back. Talking about detecting eye problems in children with pediatric ophthalmologist Dr. Jay Wisnicki. We want to go back now to some of the most common eye problems in children. Lazy eye.
Far and away the most common eye problems in children is lazy eye or amblyopia and strabismus or eye muscle problems. Strabismus happens often during infancy. We have a child with crossed eyes. People don't realize that often there's excellent treatment for it. Sometimes eyeglasses, eye drops, eye muscle exercises in older children or teenagers, and eye muscle surgery, which is very effective in treating this problem.
So if your child is cross-eyed, they don't need to be. Is that correct?
That's
I mean, there
correct.
is a way to treat that and take care of that.
That's correct. Not only that, some adults don't realize that even if this is not corrected during childhood, it can be corrected even as an adult.
And most of the time, does that involve surgery?
Not always. There can be treatments with prisms and eyeglasses, and sometimes eye muscle exercises, but often surgery is done. The surgery is outpatient, no longer even done in a hospital.
Okay. I want you just to be clear on the lazy eye. What is the difference between that and being cross-eyed?
A child's visual development starts at birth and continues to the age of 7 or 8. Lazy eye or amblyopia happens when the eye is shut off, sometimes as a result of being crossed, also sometimes as a result of an eye being very nearsighted. What's important to realize, however, is lazy eye can be effectively treated, usually with patching. Without treatment, this is the most common cause of blindness in one eye in children. And so that's why treatment is so important.
Right. And how young can a child be to get prescription glasses to fix some of these problems?
Well, sometimes during infancy, but typically we don't treat children with glasses until the age of 6 months or later, depending on the refractive error or degree of optical error of the eye.
Okay. We have a caller on the line. We're going to come back and ask more questions, but let's get to some calls. Linda is calling us from Houston, Texas. Hi, Linda.
Hi.
Thanks for calling. What's your question?
My grandson at age 7 was diagnosed with Best's disease, B-E-S-T, Best's disease. They said we can expect 2 more episodes, so to speak, at about age 10 and 18, after which he will be blind. I've searched the internet. I can't find information, and I'm curious about where can I go, or is there an expert in this field?
Okay, Linda.
Best's disease is a rare hereditary retinal degeneration, and it does cause legal blindness where a child or as an adult may not be able to see completely. Typically, you should see a retina specialist, someone who's an expert in this kind of problem, and they're located pretty much in every city around the country. It's not such a rare problem that there shouldn't be somebody in every metropolitan area, and what you're looking for is a retina specialist.
Okay, we want to be clear on that, Linda. Please make sure that you seek out somebody who can really deal with this professionally, because this is what they do most. A retina specialist is the person you want to see there. Thank you very much, Linda, for the call. There are a lot of old wives' tales, Doctor, about what's bad for your kid's eyesight. Sitting too close to the television set or reading in the dark. Is there any truth to any of that?
Not to either one. I think my mother still tells me now, still tells me now, Jay, turn the lights on.
Oh, there's some things you just can't change.
Right.
You know.
And in terms of sitting close to the TV, children do that because they want that movie effect of a very large image, but really has no damaging effect of the eyes whatsoever.
It really doesn't. Now, how does that compare to sitting in front of a computer terminal all the time?
Well, sitting in front of a computer terminal, visual tasks these days are highly demanding for children. Tomorrow's the New York City Marathon. I expect that there will be a lot of people with sore muscles. And if you sat and used your eyes all day, you'd be sore too. But certainly your eyes are designed to do that. And so they'll be sore, but they can be used again. There's no damaging effect from running a marathon with your eyes. We
want to also raise the questions about safety, playground safety of the eyes, because a lot of injuries happen, of course, at school and at play. Certainly. So let's talk about that.
There are well over 100,000 serious eye injuries per year. 90% of them are preventable, and most of them are in people below the age of 25. These are preventable with eye protection, and children, even adults, should consider polycarbonate lenses, also UV protection, UV coating for times that you're out in bright sunlight. But it's important to wear protection for most sports. Baseball, basketball has a very high incidence of sports injuries.
Now let me ask you, because in the organized sports like that, in which schools are overseeing that activity, I would presume that they are giving kids eye protection. But when kids are just roughhousing outside, I mean, is it becoming more and more popular to see kids with eyewear when they're just playing ball in the backyard? Or because we do see it with helmets and bikes. I mean, that is something that has virtually changed so much, certainly since I was a child and you were. Kids riding bikes with helmets. What about just natural play and eye care? Natural play doesn't turn out to be as much of a risk factor. Okay. But obviously working in any area where there are, projectile objects, things like that, or sports is more of an issue. Okay. Thank you, Doctor, for joining us. Thank you. Next week, controlling binge eating disorder and the latest on organ transplants. I'm Carol Iavana. In the meantime, be well. Fox News Now is straight ahead.